Hello, today we're doing an interview with Supervisor Kathryn Barger from County of Los Angeles discussing the coronavirus and its effect on all the citizens in the county. Thank you for joining us. We appreciate it. We know it's crazy times right now, and the fact that you agreed to join us is much appreciated.
No, it's my pleasure, Albert. It's important that we get the message out regarding what is going on.
Yep.
So I'm honored to be on.
Thank you so much. First of all, congratulations on your election as well. I know that you won't have a runoff in November, and we'll have you for another 4 years after November, which is much
That's right. Well, thank you, and thank you for your support, and actually the Armenian community who really did support me tremendously, and I'm very grateful.
Sure, my pleasure, my pleasure. First, again, where are we on the coronavirus? What steps have been taken? Then we'll talk about what we're going to do next, and then some questions from our viewers that we must ask as to the confusion on what's going to happen next. So tell us a little bit about what is going on with the county, what restrictions, and what we need to do.
So we put restrictions in that are basically saying it's safer for you to stay at home, which we know. If we can keep people in their homes, we can slow down the spread of this horrible virus. And so we're encouraging people to only leave if they have to go to the market, go to a pharmacy for essential goods. It's important that we try to stay off this from, if you look at what's happening in New York right now, it's because people are coming down with it and they are inundating our hospitals. We know the virus is out there, but if we can keep it to a small percentage, our hospitals will not be inundated. So we're asking people, it's a 14-day incubation period. So we're in the second week of asking people to safer at home. I'm hoping that the numbers, while they're rising, are not going to rise to the level of inundating our hospitals.
And the numbers are rising due to the fact that we didn't have testing before. So numbers were lower because people weren't testing as much. And in addition to that, the hospitals hadn't processed the testing. So we were expecting to get some higher numbers, correct?
Correct. I mean, and testing is a tricky situation because number one, sometimes you can test and show a negative when in fact you are carrying the virus. This virus can lay dormant for days. And so the tests are not a perfect solution to really identifying who out there has it, believe it or not. So we are limiting testing right now. We're getting 20,000 kits online by Friday, and those are going to be for first responders and healthcare workers that are on the front line, with the goal of expanding the testing, because as we become more sophisticated, right now Quest takes about 6 days to process it. We've got tests now that can do it in 48 hours, and time is of the essence in identifying those that are testing positive so we can get them the treatment they need if they are severely, and the treatment being respirators for those that need to be hospitalized.
Also, there was a bit of a confusion. They say drive-through testing, but that testing is not for just people that are healthy that just want to get tested. It's caused a lot of confusion. People are driving to those places, and they shouldn't be doing that, correct?
Correct. And the city of LA rolled one out, and it was originally intended for first responders. And then they rolled it out and said, if you want to be tested and you meet the criteria, which is a doctor's order, and you are showing symptoms, you can go online and sign up. I know that there are some hospitals as well that were doing that on a case-by-case basis. But again, there's criteria that has to be met. I mean, knowing that the kits are not fully available to everybody, we're trying to be as cautious with who's getting the testing so that we are in fact giving it to those that really do need to be tested.
There was some questions. As you know, this would be aired not only on ARTN TV, but also will go statewide to Facebook and Instagram. And we had some questions in reference to what is the date that the county has currently on the stay home order?
I'm sorry, what is the
date that you guys currently have set where people cannot go back to work until, and then we'll discuss it.
Yeah, so right now we did it early April 9th, I believe, but in fact, that is not a hard date. The state had until the end of April, I believe. We are playing it on a week-by-week basis based on the numbers. And again, for us, we're tracking, and this week is going to be a very, very important week to really see if the Safer at Home is working. Because if we can keep those numbers, and again, we know they're going to go up, but keep them at a rate that will meet the demand in our hospitals, we'll be in good shape. But the Safer at Home is early April at the minimum. It could go longer.
That brings me to my next question, which is the toughest question of all, probably.
Yeah.
We have people that are at home, not working, and I understand that hopefully there'll be the Senate bill will pass, and then the House will help. Before we go into that, actually, I want to do that in the second segment. How helpful has the federal government been to the county?
The federal government's been fantastic, and they have been a partner. When we first realized that this was going to be a problem, they gave us emergency finance funding immediately, even before I signed the declaration of emergency. They released over $2 million just to get us started, and they have been incredibly cooperative as it relates to fast tracking. We've asked them to look at the FDA in terms of the testing kits, and they've been so responsive. I cannot say enough good things about not only the federal, but also the state. We have had an incredible relationship, and it even goes down to the fact that we've got the USS Mercy coming to LA, which is going to be a 1,000-bed hospital operated by the Navy. And this came because both Dianne Feinstein and Kevin McCarthy, so bipartisan, advocated for LA County to get it. And then the vice president made the determination, and the president of the United States announced it. So, it's not perfect, Albert, but then again, what I tell people is I've never in my life experienced anything like what we're going through now. So nothing is perfect, but I have to tell you that the response we've gotten from the federal government has been incredible.
That's great. How were we prepared? Was the county prepared for as prepared as they should have been for something like this? I know that you can never prepare for this type of a situation ever, but from everything that I see, the response time, the order, everything else, as difficult as it might have been, because it was difficult for me to send my employees home and work remotely. But as difficult as it's been, it seems like it's working. So what is your understanding of how the inner department work has been, and how easy it's been to work with them?
So I'll answer the first part by saying that, with influenza, we are prepared to deal with flu season. And so we have in place protocols as it relates to what people need to do. This coronavirus takes our plans on influenza to a whole new level, because I tell people it's the fear of the unknown. We don't know how this is all playing out, because we don't know what the incubation period is on the surface. We don't know if it's droplet versus airborne. And so we're learning something each day. And I take my hat off to our public health department, who truly has stepped up to the plate and has led as it relates to ensuring public health is first and foremost. I also take my hat off to our county family, because while we are at the front line and when we all are hired, we have to sign something saying that in time of need, we are emergency responders, pure and simple. But we also need to recognize that our county employees are also have families and are human. And so we've had to really march that fine line between being sensitive to them as it relates to the fact that they are equally as concerned and afraid, but they have to step up and be there to respond to those, within LA County that are going to need our services. So I think we've done a great job. Is there room for improvement? Always, Albert. But, as a county family, I've never been more proud of each and every county employee and what they've done, each department, what they've done to step up to the plate, to make sure that we get food to our seniors that are homebound, to make sure that our foster youth are still taken care of, to make sure that if there's a child abuse case that comes in, social workers are still going out on the front line and investigating. our nurses are going in, and we have a lack of equipment that we're really trying to get more inventory on, but they have stepped up to the plate and said, we are here to serve. So I'm very, very, very proud of the county family.
Again, I read a note today that says for the first time, we have the supermarket workers, the county workers, the ambulance workers being ranked higher than the sports and actors, which is the best thing that has ever happened, maybe, because they're much unappreciated.
And our first responders, you know, our firefighters and paramedics and our sheriff's deputies and police are going out there, and in the face of a silent disease that you can't see, they are still responding and showing up to work. And, you know, you're right. I mean, these are the people that day in and day out do their job. And this is one where, because of the coronavirus, they're walking into something that is truly unknown in terms of where it can go, what it can do, and the impact it's going to have on the community.
Yeah, much appreciated, and thank them for on behalf of the community. Let's do this. Let's take a quick break, go to a commercial, and we'll continue our interview right after the commercial. Welcome back. We're back again discussing coronavirus with County Supervisor Kathryn Barger. Thank you again for coming. Let's discuss some hard issues that you probably hear on a daily basis. Both our viewers and people on Instagram, Facebook have said, when are we going to go back to work? Because we can't just be off work until May or June. So sometimes you have to balance health with economy and what people have to go through. And, you know, sometimes people stay home with their kids for 2 weeks, and now they know what teachers go through on a daily basis. So what is the end plan? Because this can't go on forever.
No, absolutely. And that's why, again, we're doing the safer at home in order to slow down the spread and get a handle on this. And as you know, or if you don't know, New York right now is trying a new medical protocol to see if, in fact, there's medication that will address those that are coming down with coronavirus. So we're trying to buy time, quite frankly, to try to come up with, number one, something that will treat it, but also a vaccine. So the longer we can keep coronavirus from spreading into the community, the better off all of us are. And that is why it is so important for people to really heed the advice and stay at home and limit their exposure in the community. If we can do that, Albert, we'll get back to living our lives sooner. Having said that, you know, I fall in the middle. I mean, people were critical of the president for saying we're going to bounce right back and, you know, we're going to be fine. You know, I believe it's going to take time, but I think it's important for us to give people hope. And right now, many people are facing a lot of anxiety and fear because they don't know where their next paycheck's going to come from. So I think it's important for us to balance realistically what we can expect over the next few months. But again, if people will cooperate and slow down the spread of this virus, we will be able to get a handle on this. And hopefully in the next 30 days, you know, God willing, the tests that are being done in New York will show a favorable response as to what the medication is doing to those individuals that have come down with coronavirus. And then we can roll that out for people. And then we can all take a breath and a sigh, but still be aware social distancing is a reality and washing your hand is a must.
Yeah, I'm a big hugger and handshaker, and
me too.
Life has changed forever.
Yeah.
I think it's when it comes to that type of thing, it's like 9/11 changing your life forever. We'll never go to the airport the same way. We're not going to be able to greet people the same way, but hopefully at least we'll be more relaxed. What is the, if it ends, if there is an end in sight, would there be another a discussion, a news conference? How would people know about the end of the order not to go back to work?
So every day, LA County, well, every day but Saturday and Sunday, but during the week, LA County at 12:30 does a briefing. And what we do is I give an opening just to let people know. And today I'm going to be talking about the impact this has had on the homeless community and what we are doing to address that. And then Dr. Ferrer, our public health director, will talk about the numbers and where we go from here. So each and every day at 12:30, and it's carried by all the news stations, we give updates in order to let people know what is going on. But if people don't watch TV, they can go to the web, to lacounty.gov, lacounty.gov, and click on coronavirus. It's actually COVID-19, and that will give an update each and every day, and it's in real time. Or they can go on my webpage, kathrynbarger.gov, and take a look, because we're giving daily updates as well.
Okay, and then what we'll do is we'll put the actual right underneath, so that people could actually see it and they can write it down if they need to, both yours and COVID-19 from the county. Again, one other issue is, I have a teenager at home in schools, and how, they're doing online studies, but people who are graduating, people who are doing different things, it's probably the worst time to be a senior, as you can imagine.
Yeah.
What do you tell people in reference to looking forward to May and getting together for graduation and doing other things? We have to cancel my son's birthday, for example. What do you think, based on the number you've seen, where are we going to be? It seems like the numbers this week is going to be the most important numbers that you're going to see.
Yeah, well, actually, it's funny because just right before I came on with you, I got a notice that my best friend's daughter's postponed her wedding. And that was supposed to be the end of May. And so I know the impact this is having on everybody. And for my friend's daughter, she's old enough to understand that this too shall pass, and their marriage will come in August. But for those young people that are in high school, I remember when I graduated, I remember my prom. And these have all been put on hold. And for these kids, it's not even going to be that they can do it later. They've missed that opportunity. And all I can say is that, that in life you do have disappointments, but there is a way to make that up. And I think what they're talking about doing is trying to put together a virtual graduation, which is not the same. And I know that, Albert. But at the same time, this is, in my time with the county in 30 years, I've dealt with a lot of crises as it relates to the financial crisis with our healthcare system. I've never dealt with anything like this, but we've had to tell people basically shelter in place, and that you're safer at home. And we've closed down businesses, which for many of these people, the anxiety that they have is real. So I appreciate the difficulty for our young people who truly we are taking away something that is a rite of passage, if you will, toward adulthood. These are monumental moments that they will not be able to get back. And it's unfortunate and it breaks my heart, but there's nothing we can do to change that at this point other than to try to get a control of the spread of this virus so that we can get people's lives back to a somewhat normal state. And I don't even know what that normal is going to be, because to your point, I think things have changed forever. And we're still going to have to figure out what that change is. But clearly, we're going to be doing things a lot different.
Yesterday, we had a takeout Tuesday where we basically support the local restaurants, because I think probably movie theaters and restaurants are probably the most hardest hit during this time. So that's something that really need to be promoted, maybe 2 or 3 times a week. If you can get a takeout and bring it in, I don't know, you need to microwave, whatever you need to do to even get more protection, but that's something that you support, correct?
Absolutely. I mean, I think it's important for us to support each and every business in our community. And I mean, my nails are going without, so I'm going to be buying a gift certificate because they also live paycheck to paycheck. And so it's important for us to support our small businesses. Obviously, given my schedule right now, takeout is something that I wholeheartedly support. Otherwise, my husband won't be eating. But I think it's important for us to support businesses now more than ever, because they also have bills to pay.
Right. Well, thank you very much. I appreciate you coming in. I know how busy you are. I know what times we live in. And the fact that you take the time and come in shows the type of leadership that we have in this county with you and the rest of the county supervisors. And it's much appreciated. Thank you very much, and best of luck to you and the rest.
Thank you, Albert. And I have to give a shout out to my colleagues, because while I'm the face, because I'm the chair, each and every one of my colleagues has been incredible, because we're all in this together. And while we all represent different districts, we all represent the county of Los Angeles. So I really appreciate you having me on, and God bless you and all the viewers out there. And please take care of yourselves and abide by the safer at home.
Thank you very much. Have a good day.
Thank you. Thank you.